Welcome to the ACED podcast, where we turn science into sense. This is season 10, and in this season, we will provide 10 knowledge-packed episodes with the hopes of helping listeners understand what we can all learn from current research on overdose. It's a hard topic to discuss, but critically important information to know. So I am honored that you're with us. I'm Danielle Rudes, your host, and this is ACED. Welcome to this episode of the ACED podcast. Today, we are delving into a pressing issue within the intersection of public health and criminal justice: opioid use disorders among incarcerated populations. In this episode, we'll explore why these disorders are disproportionately high among incarcerated persons and the critical implications this has on their health and rehabilitation, both on the inside and after release. In prisons, opioid use disorders are rampant, driven by a number of factors. As we've discussed in prior episodes, many individuals enter the system already grappling with addiction, often stemming from socioeconomic challenges, trauma, or untreated mental health issues. Once incarcerated, access to effective addiction treatment becomes severely limited, exacerbating the cycle of substance use. And while prison is meant to be an environment that is drug-free, that is not reality. In fact, oftentimes the prison environment itself contributes significantly to the prevalence of opioid use disorders. Stress, overcrowding, and a lack of meaningful activities can intensify psychological distress, prompting individuals to turn to opioids as a coping mechanism. And yes, they can get them in prisons and jails. These drugs offer temporary relief from the harsh realities of confinement, creating a dangerous cycle of dependence. And it doesn't end there. Most people who are incarcerated are going to re-enter their communities. Any guesses on what % of incarcerated individuals will eventually be released? I'll give you a hint. It's probably higher than you think. The answer is 95%. Yes, 95% of people who are currently in our nation's prisons will eventually be released back into society. That means improper substance use treatment will vastly impact their re-entry and the communities they return to. In fact, the transition from incarceration back to society poses another critical risk factor. Many individuals lose their tolerance to opioids during imprisonment. Upon release, if they resume use at pre-incarceration levels, their risk of overdose skyrockets, a phenomenon known as post-incarceration overdose. This underscores the urgent need for comprehensive support systems during reentry. The articles we'll be talking about today discuss these issues. In one study spanning from January 2015 to December 2019, Victor and colleagues analyzed data from all jail bookings events in the country. They found a concerning link between incarceration and overdose risk. During incarceration, individuals faced heightened overdose risk due to disrupted access to substances and changes in tolerance levels. Again, the story didn't end there. Post-release, the authors found that the risk of fatal overdose significantly increased. The study revealed that individuals who had been incarcerated within 2 years prior to their overdose accounted for 21% of all overdose-related deaths in the country. Each prior booking increased the hazard of mortality by about 20%, highlighting the enduring impact of incarceration on health outcomes. Plus, specific factors exacerbated this risk. For instance, individuals charged with possession of syringes at their most recent booking prior to release were at more than triple the risk of mortality post-release. This finding underscores the critical need for targeted interventions and social support systems for individuals with substance use disorders transitioning from incarceration back into communities. The implications of these findings are profound. They emphasize the urgent need for integrated approaches within correctional settings, including access to medication-assisted treatment, or MAT, and harm reduction strategies. Additionally, enhancing post-release support systems, such as mental health services, substance use counseling, etc., are all crucial to reducing overdose fatalities among formerly incarcerated individuals. In the second recent article we'll be talking about today, titled "To Put a Dent in Opioid Addiction, Start with the Correction System," Levinson, 2014, emphasizes the pivotal role of the correction system in addressing opioid addiction. Levinson highlights that a significant number of individuals struggling with opioid use disorder pass through the correction system, making it a crucial point for intervention. The article underscores the challenges faced by incarcerated individuals, including limited access to effective treatment for opioid addiction. This exacerbates their condition and increases the risk of overdose upon release back into the community. As we discussed earlier, the transition from incarceration can be particularly precarious, with heightened risk of fatal overdose due to reduced tolerance and inadequate support systems. To address these issues, Levinson proposes several key reforms. First and foremost is the expansion of access to medication-assisted treatment within correctional facilities. MAT, which includes medications like methadone, buprenorphine, has proven effective in reducing opioid use and preventing overdoses. Implementing MAT during incarceration can stabilize individuals' health and improve their chances of successful reentry into society. Additionally, Levinson advocates for advancing screening and assessment processes in jails and prisons to identify and treat substance use disorders early. This proactive approach can mitigate the progression of addiction and reduce the likelihood of future criminal behavior. Furthermore, comprehensive reentry programs are crucial. These programs should ensure continuity of care by providing access to addiction treatment, mental health services, and social support upon release. By bridging the gap between incarceration and community life, these programs aim to reduce recidivism and promote long-term recovery for individuals struggling with opioid addiction. Overall, Levinson's insights highlight the urgent need for reforms within the correction system to combat opioid addiction effectively. By integrating evidence-based treatments like MAT, improving screening and assessment protocols, and establishing robust reentry programs, we can create a pathway to recovery for incarcerated individuals. This not only benefits their health and well-being, but also contributes to safer communities by reducing overdose fatalities post-release. These efforts align closely with our previous discussions on the impact of incarceration on overdose rates. Addressing the complex relationship between opioid addiction and the correction system requires a coordinated action and policy reform strategy aimed at fostering health, resilience, and successful rehabilitation for all individuals involved. Last but not least, we'll talk about an article titled Identifying Structural Risk Factors for Overdose Following Incarceration, a Concept Mapping Study, where the research team, Nall and colleagues, 2024, also investigate the complex factors contributing to overdose deaths among individuals recently released from incarceration. This research sheds light on the structural challenges that amplify the risk of fatal overdoses in this vulnerable population. Differing from the previous study, this one employed concept mapping, a participatory research method to identify and prioritize structural risk factors. These factors include systemic issues such as lack of access to healthcare, fragmented social support networks, and gaps in continuity of care during the transition from incarceration to community life. These structural barriers not only hinder individuals' access to critical services, but also contribute to their heightened vulnerability to overdose. One of the key findings from the study is the critical role of the social determinants of health, such as housing instability and unemployment, in shaping overdose risk post-incarceration. The instability and lack of resources exacerbate the challenges individuals face in maintaining their recovery and avoiding relapse into substance use. Moreover, the study underscores the need for comprehensive policy reforms and community-based interventions to address these structural risk factors. Integrating supportive housing programs, employment assistance, and expanded access to healthcare and mental health services are crucial steps in mitigating overdose risk among individuals re-entering society from correctional facilities. The insights from Nall and colleagues' work Complement our previous discussions on opioid addiction within correction systems by highlighting how structural barriers within healthcare and social support systems contribute to the persistent cycle of substance use and overdose among formerly incarcerated individuals. By understanding and addressing these structural risk factors, we can enhance the effectiveness of correctional reforms, such as expanding medication-assisted treatment and implementing comprehensive reentry programs. These efforts aim not only to improve individual outcomes, but also to foster safer communities by reducing overdose fatalities and promoting sustainable recovery. Hopefully, this has provided you with some insight on this vulnerable population and has shown you how advocating for evidence-based interventions can help us work toward ensuring safer transitions for individuals exiting correctional facilities. We also need to consider timing. The first 24 hours of an individual's release are critical. Perhaps we need to think of ways to speak with family, peers, and other support networks of those who are about to be released to warn them of these risks and prepare them for what they can do. Thinking back to our last episode, they may want to be provided with Narcan, which can help save a life in need. If you're interested in more reading, you can check out a few more articles on death and dying in prisons and jails, including their collateral consequences. For instance, Albizu and colleagues, as well as Novisky and colleagues, highlight what one experiences when witnessing death during incarceration, whereas Thrush discusses how many suicides could have been averted. You'll find a Bizu Garcia and colleagues article from 2009 in the journal Harm Reduction. You'll find Novisky, Narvi, and Prost's article in the Journal of Criminal Justice, 2022, and you'll find Thrush article in the New York Times from 2024. All of those resources will be available on the one-page handout that we provide to go along with each episode of this podcast. Go to the podcast website on the JTech page, and you will find one-page handouts to accompany every episode that we produce. Everything you need to know about this episode is there, including the additional resources I mentioned. Thank you, and take care. Thank you for listening to the ASTIT podcast. We love hearing from you, so if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write me, Danielle Rudes, at Sam Houston State University. My email is drudes@shsu.edu. And as always, thank you to the Justice Community Opioid Innovation Network, or JCOIN's Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriters, Dr. Chelsea Narvi from Sam Houston State University and SHSU master student Jalen Magana. And a huge and a heartfelt thank you to Jason Luchin and the team at Slonky LLC for their wonderful production, as always. Tune in again soon for another episode of ASTIT.